Hello and welcome to the House of Wellness, and here we are in our outdoor office again, getting the vitamin D. It is absolutely gorgeous.
Jo, spring has certainly sprung, so let's get right into it. Today is all about some amazing medical marvels and a few great health tips too, Duff.
Jack, I'm blown away by some of the stories we share on the House of Wellness from our fine medicos around the country. This week, a tech advancement in heart transplants and a treatment for alopecia you need to hear about.
Today, our beauty buzz is all about getting your glow on, and we'll take a look at the body's largest organ and how to care for it, which is, of course, your skin.
We love supporting the fight to find a cure for MND, and this week we hit the road with the Daniher family. The Daniher Drive takes us through rural Australia.
And while today we don't have Dr. Nick beside us...
You got me.
He's going to be taking a look inside us, which, not us personally, that would feel rather uncomfortable, but he's going to be answering that question. What is the human appendix for? Do we know?
No.
We've all wanted this, haven't we?
Now, food's a big part of the House of Wellness, and I get the feeling about you, Jo and Jack, that through COVID we all ramped our skills up a little bit on the food front.
Well, I certainly didn't teach myself how to cook bread like everybody else did, but I spent a lot of time during lockdown just thinking. Got back to a lot more meditation, but I don't know, what about you? Did you write the great novel? Did you learn a new instrument?
No, I sadly didn't. But for some people, the last few years were all about being productive and trying something new, including one Melbourne couple who discovered the secret to heavenly scrolls of the eating kind.
When I'm craving something sweet, I can't go past a huge piece of chocolate cake. But for Sebastian Castro, his first bite into a doughy sweet pastry left a lasting impression.
Well, I'm a big fan of cinnamon scrolls. The first time I tried one, I was blown away. I remember back with my mom, we were trying to make them and try to imitate in some way, like the ones that I tried before, but it was a failure.
It was during lockdown that Sebastian revisited all those failed attempts to recreate his favourite pastry, and with his partner Annabelle, finally perfected the cinnamon scroll.
I don't think there are many people out there who haven't tried a cinnamon scroll, but just in case, how would you describe the flavour?
Well, I will describe the flavour as a perfect balance between the sweetness, between the earthiness of the cinnamon, and the tartness of the cream cheese icing. It creates like a perfect gooiness and a perfect balance in every single aspect of the cinnamon scroll.
And it seems most of Melbourne and beyond agree, with orders coming in to Sebi scrolls from all over the shop. Sebi and Belle have created a scroll sensation.
It's your scrolls. I think coffee won't be long. It was like such a shock, the way that from starting to now, we would never have believed that it would be this big and this popular. The turning point for us was once we started, the feedback we just continued to get was like, wow, okay, are we really onto something here?
Sebi scrolls are proof that if you get the recipe right, the people will come.
Oh yeah, that's good.
But Sebi reckons there's more going on than just the ingredients.
Yes, there is a secret ingredient, and it's you have to love what you do. The process is a very long process. It takes a lot of hours to make cinnamon scrolls. But the most important thing is that we enjoy the process.
It's funny, we don't usually do two to a dough. It's very romantic, isn't it?
Sebi and Belle don't just make the perfect scroll, they're also the perfect team. Belle does the books and Sebi makes the dough.
Can I just get 5 for your classic roll?
Sure. I think one of my favourite parts about the business is the community around here. I never would have expected the amount of support you receive from strangers that have backed us from day one. Everyone's always wishing us well, wishing us luck, and, you know, waving to us, you know, when we're still here at 6 p.m. at night and they're coming home from work, and, you know, it's just been so lovely.
And if you're wondering if there's anything healthy about a cinnamon scroll, well, they do use fresh ingredients and butter, a lot of it.
We need to make sure that every single part of the dough is covered with butter. So we do put a good amount of butter. It's like painting, you know?
It is an art form, what you're doing right now.
Absolutely. So we want the butter to be very fine, so it well spread everywhere.
And the art isn't lost in the production, even with orders this big.
We are now making around 5,100 cinnamon scrolls, yes. On weekends, we can sell up to 2,000 scrolls, and we even sold out by midday.
Thank you. The fact is, most of the time they come straight out of the oven, so they're still warm, and the smell is quite, I guess, intoxicating from that perspective.
I got on my trim.
Me too. Guys, if health and happiness are linked, biting into one of these is absolute bliss. And I like to think that happiness is the highest form of health, no?
Absolutely.
Right, let's do it. Oh my God, that is outrageous. It's like fluffy and gooey. I'm in heaven, absolute heaven.
Gotta love it when a brilliant idea pays off, don't you, Joe and Jack? And the great innovation continues in the health space. In Rwanda, they're running a successful blood delivery program by drone. Can you believe that?
No, Darcy, it's amazing. And what's really interesting is, of course, Rwanda, it's very rough terrain and a lot of the villages are very isolated. So a few years ago, the government partnered with a San Francisco startup to make zipline drones.
Their aim is to get Rwanda's 11 million people access to blood and any other medical emergency supplies within 15 to 35 minutes. That's amazing.
It's an incredible story, and the great innovation is happening closer to home as well, Joe and Jack. How about this? Two Australian cardiologists have developed a box that, wait for it, enables the human heart to stay alive outside the body for double the time. Have a look.
Up until now, the way to store a heart, particularly coming over a long distance, was just in ice. In Australia, we're often faced with long transport times, and we know that for hearts stored on ice, as every hour ticks by, the risk that the heart won't pump adequately when it's placed into a heart recipient increases, so the risk that there would be a problem is substantially more. So this is the actual machine that perfuses the heart, delivers a cool solution while the heart's being transported, and the heart will be placed in this chamber. And then the other critical part of what's going on in this box, it's very transportable, is delivery of oxygen and important nutrients with a pump. So this new system basically gently allows a cool solution which has some nutrients and some oxygen to gently run through the organ, and what we've found is that keeps it in a much better situation, so that when it's transplanted, the function is much better immediately. The effect on the time that we can confidently use a heart that's been preserved outside the body it's actually been amazing. So in the trial that we and our colleagues around Australia and New Zealand did, the longest time was out to nearly 9 hours. And we never ever would have done that with an ice-preserved heart. What we've started to find is that when a heart's stored in this heart-in-a-box system, other organs seem to work better early after the transplant. So the kidneys work earlier in the intensive care unit, which is great. So it seems to be much better for a lot of other organs. All of the patients who participated in the trials are all doing well. It's important to remember that most of them would never have been transplanted because they received hearts that came from a long distance, and they're all doing great. For me personally, it's been a fantastic journey. It's not very often in your career where you say, actually, I really changed something huge. We all feel that this is the next level of development in heart transplantation, and if we leave that as a legacy, we'll all be very happy.
I think we're all starting to get an understanding here on the House of Wellness that a good night's sleep may be the most important thing we can do, Joe and Jack, for our health. And we all know that feeling when you don't get a good night's sleep and you wake up feeling irritable and mentally and physically horrible. But now a study's proven that certain smells can only help you sleep better but sharpen the mind at the same time, Jack.
Especially as we age, us. A US study tested scents like lavender, rosemary and peppermint on a group of 65 to 70-year-olds for months before sleep. And what they found is that those who were exposed to those smells had better learning and recall than those who didn't.
I just love that. And, you know, there's a lot of discussion around how smells can change our brain structure. So that makes perfect sense. And I have to tell you, when it comes to peppermint, I would take that over some of the smells in my house, Stars. What do you reckon about teenage bedroom smell? That's a particular kind of odour, isn't it?
I've had too many teenagers in my life for way too long, Joe. That is a smell that keeps you up at night. I need the health department to come to my house to clean up some of those bedrooms. It's disturbing. Up next, we're going to hit the road for the cure to MND as we join the Danihers on a fight to find a cure.
You might have seen the recent Beyond Blue survey of teachers that showed that the #1 problem young people are facing at the moment is poor mental health. And we're talking anxiety, depression, body image issues. It's so concerning, Jack.
Oh, as a mum of 2 young girls, I am so conscious of this, particularly anxiety, and we're seeing an increase of it in young boys too.
Joe, you and I share a passion for meditation and the side effect-free benefits it has in reducing stress. And now some news out of the US is showing that guided meditation is actually just as effective as antidepressants in treating anxiety disorders.
Well, you're right. Mindfulness and meditation are my go-to when it comes to mental health for me. And this US trial that you speak of, it's a world first. And the results are so exciting for people who can't afford prescription anxiety medication or who have negative side effects. It's so great.
We're so lucky in Australia to have access to the best medical minds and breakthroughs. And at Melbourne's Epworth Hospital, there's a new radiation treatment that's giving hope to cancer patients.
Pancreatic cancer presents very late. We know that it's often vague symptoms, often overlapping with most other areas of gastroenterology. So therefore, the majority of patients, once they get to a diagnosis, sadly, it's already spread around the body and surgery is not an option. There's a group of about 30% where it's spread just beyond the pancreas wall, but it hasn't yet spread around the body, and it's this group we really want to target. We're very excited about a new product where we can directly inject particles that emit radiation into the centre of this tumour and only target the tumour itself. There's no radiation outside of the tumour itself, with the plan to try and shrink it down and get them to surgery. We know that this can be done safely. It can be done as a day case. We can put a camera inside the stomach and under ultrasound guidance, stick a needle directly into the tumour and put these particles into the centre of the tumour. What we've done so far is a series of patients with this injection of radiation above standard of care, and we were thrilled to discover about 43% got to the point without any side effects, that the tumour shrunk to a degree that we were able to offer them surgery, and that's a really exciting thing to be able to talk about. Patients don't know much about pancreatic cancer, but what they do know is when they hear that word, that it's really likely to be a poor prognosis. And many patients talk about the anxiety that they feel, as with their families, and around the potential that this is really a death sentence. So for patients who've been told they can't have surgery and that there's an option on the horizon above standard of care that potentially has a better chance to get them to surgery and a better long-term outcome, for patients and their families, it's been an overwhelming happiness, and for me as a clinician it's been really exciting to be able to have something to offer them when there's been so little big gains to be made over the last 30 years.
One of the events we love getting behind here on the House of Wellness is Fight MND, and the courageous Neil Daniher and his daughter Beck fronting a campaign which raised nearly $100 million, can you believe it,
Amazing.
to help find a cure for motor neuron disease.
Well, Darcy, we're all very familiar with the big freeze, the iconic blue beanies, and I know you know the slide well.
One of the great experiences to go down the slide and support the Daniher family.
But the other important fundraiser for Fight MND is Daniher's Drive, Joe.
And the famously fun road trip is taking place throughout regional Victoria right now. We caught up with the driving forces behind the fight to beat the beast.
When Neil first told us that he had motor neuron disease, of course we didn't know too much about the disease at that point in time, and we very quickly Googled and tried to find out as much information as possible.
So every day in Australia,
2 people will be diagnosed with MND and 2 people will die from MND. And currently in Australia, there's about 2,100 Australians living with the disease. So MND is an incredibly complex disease. There's a reason why we call it the beast. So a person's muscles will start to waste away. They'll start to lose the ability to use their hands or to walk, to talk, to swallow, and ultimately to breathe. And it's a really rapidly progressing disease. So in most cases, a person will die from MND within 27 months from diagnosis.
When Neil said, right, I've got a concept, I've got an idea, he came to myself and a few of my teammates, my Melbourne Footy Club teammates, and we said, right, Neil, we're behind you in whatever you want to do. So, you know, they kicked off the fundraising, they kicked off the big freeze at the G.
Looking back at where we were 10 years ago, and for someone who was diagnosed, there really was little hope. So with this funding, it's allowed to create a pipeline of research. So from laboratory research, looking at what causes MND, to drug development research, so turning those discoveries into treatments, and then clinical trials for Australians to give them that opportunity and that hope of finding that potential treatment and a cure for the disease.
One of the beautiful things about the Daniher Drive is that it provides a place for those families and friends and people to come and connect, not only to raise the money, which is what we're trying to do, but it connects people, connects families with similar stories. It's part of the grieving process, it's part of celebrating the people that are no longer with us. It's really, really powerful. We've got about 300 people, 80-odd cars, and we're going around, starting at Swan Hill, through to Shepparton and over to Ballarat. Along the way, there's a function each night where we fundraise. I think it's really important for the communities, obviously really important for the foundation so that we can raise more money so that Beck can do more work and we can actually go and find a cure for this beast. There's lots of ways to show your support, but we're on the drive now, so come and join us at one of the events.
Or you can head to your local Chemist Warehouse and donate there, or to our website, fightmnd.org.au.
Veins play a really important role as part of our circulatory system by working together with other blood vessels and the heart to keep blood moving. In our legs, blood is collected in superficial veins underneath the skin surface and transported to deeper veins in the calf muscles. The muscular actions in our calves help pump blood against the force of gravity up towards the heart. Healthy leg veins also have a one-way valve to stop blood from flowing backwards. Mild varicose veins occur when the valves are damaged or they simply stop working, which causes blood to flow back down the leg and pull in the vein, stretching and weakening the vein wall. In appearance, mild varicose veins can look twisted, knobby, or darkish blue underneath the skin surface. It can also create this visual eyesore, or it can come with symptoms of leg swelling, pain, itchiness, and this feeling of tired or heavy legs. While there's no official cause, varicose veins is more common as you age or if you've got a family history. Other factors that may increase your risk are things like standing or sitting for long periods of time, obesity, pregnancy, or other hormonal changes like menopause. If you don't have varicose veins, prevention is key through regular exercise and maintaining a healthy weight. Another hot tip, try avoiding those high heels. Now, on the other hand, if you've already developed varicose veins, we can turn to supplementation for support. Look for one containing the herb butcher's broom, which helps relieve symptoms of mild varicose veins. Other ingredients you want to be looking for are things like grapeseed and vitamin C, which help support blood vessel health, as well as the formation of collagen, which is a key part of blood vessel structure. A cream may also be applied topically to support the health of blood vessels, with a blend of nutrients like magnesium and jojoba oil, and herbs like witch hazel, which is traditionally used in Western herbal medicine. Luckily, we don't have to just live with mild varicose veins. A simple conversation with your healthcare professional will help ensure the only spiderwebs in your life are the ones on the ceiling.
Well, apparently one thing that's really bad for your vein health is too much caffeine. Now, I don't drink coffee. My body is a temple. But the guidelines are always changing, aren't they? Can you have 1 cup or 2? How much caffeine is good for you?
I try and keep it to 2 coffees a day, Joe. I love my coffee. It's my favourite thing to start the day. You and I both did breakfast radio.
Yes.
I did it with Will Anderson, and I would swear he would have 12, 13, 14 coffees before we'd finish the morning. Extraordinary.
That is an awful lot of coffee, but researchers believe, and yes, there is a researcher for how much coffee people drink, they believe that how much you can actually tolerate comes down to genetic makeup. So that's why some people can have a coffee at 10 p.m. at night, Will Anderson, I'm sure, and still have a beautiful night's sleep. But then other people like yourself, perhaps, probably couldn't even have a smell of coffee after 4 p.m.
And that makes sense to me, Jack, in lots of ways, doesn't it? That your genetic makeup affects your ability to absorb different levels of caffeine. But have you ever had that feeling where you have overdone it, your heart starts racing a little bit? Are you familiar with that? Not for you.
Yeah. I don't mind that feeling.
Well, the flip side to ODing on caffeine, rest and relaxation are the keys to wellness and letting the body heal. And as Luke Hines discovered, tapping into that can be a reflex reaction.
I am definitely a sensitive soul when it comes to my feet. Get it? I know, terrible pun, I'm sorry. But when it comes to massage, I definitely choose full body over just my feet. That's because, well, when touching my feet, things can get a little bit, let's say, ticklish. But today, I'm putting my feet in the hands of someone who knows exactly the pressure points to touch to unlock the pathways to better health.
How's your lower back? Do you have any issues with it?
No issues with the lower back.
That's good. Because I felt a nerve there that just moved as I worked on you.
Oh, wow, I felt it move.
Did you feel it move? Isn't that interesting? And basically what reflexology is trying to get the nervous system back the way it should be. So that's
Kate, reflexology is so much more than a foot massage. What's it all about?
Well, Luke, when you're working on the feet, you're actually working on the whole body. The reflexologist actually sort of thinking as they're working on the feet, hang on, this person has had some issues. It might be liver, I don't know, it could be a problem with their foot, it could be a problem with their shoulders, but you make sure that you cover the areas where the issues are. I don't know if you want to hear this, but I'm working right on your brain now. Does that feel a bit strange?
I like that you're working on my brain.
Oh, that's good.
It's good.
That's good. Does it feel a bit prickly?
My brain or my toe?
Your toe.
Yeah, it does.
If someone had never heard the term before, how would you, in 30 seconds, describe to them what is reflexology?
Okay, reflexology works on the nervous system. And so as a person has a reflexology session, they become more and more relaxed. And the nervous system settles right down. Any blockages in the nervous system are removed. And when they walk out the door, they just feel as though they've just spent 6 days in a spa area. It's just a wonderful feeling. So here.
Yep.
Right, so that's sort of...
That's really tender.
Yeah, that's just where your neck joins to your back just there.
It's interesting because that's where I've got pain.
I want to track back for a minute, though, because reflexology is steeped in history.
Absolutely, yeah. It goes back about 5,000 years. There's history in the physicians' tombs in Egypt going back 3,300 years. But there are many other stories throughout the world with other people who found it, worked with it, and a lot of them didn't write it down. I'm going to work on the other side of this big toe because that's your jaw.
Are there other parts of the body? I mean, I've heard ears before can also be a part of it.
There are other modalities. I do some auricular therapy, which is on the ears. And once again, there are charts that show you where all the points are on the ears that relate to the body as well. And while I'm doing this, what I'd like you to do is move your jaw around. That's perfect.
Now, talk to me, because I did mention acupressure points. Is reflexology similar to acupuncture? How do they differ?
They have different points and they're called meridians. And the meridians are throughout the body. With reflexology, when I'm working on the feet, it also affects the energy as well. But it's doing it through the feet, and so it's quite different, and they're called reflex points. There are less reflexology points than there are meridians throughout the body. Now, has that pain gone? No, not in your neck, in your jaw.
The pain on the toe's gone.
Pain on the toes
and my
gone.
jaw feels loose.
Looser. That's
But
what
look at me, desperate for my neck to be. What do you think's so special about the feet?
Well, there's 4,700 nerves in each foot. So, yes. So if you're going to work on the nervous system, it's a good area to work.
It's very relaxing, Kate.
It is. And I know you've relaxed. Do you know how I know? Because your feet are sweating.
Ah.
And when you relax, all of a sudden, the fluid comes out through the feet. It's very interesting.
I'd have to say, when it comes to relaxing, I'm pretty good at it, but this took it to the next level. As Kate started to talk through the different points on my foot, I was listening, but I also found myself really wanting to drift off and float to another space. Now, when it comes to connecting my feet to different parts of my body, I don't understand how that works, but I'll tell you this. There was tension in the feet that was relieved, that then has relieved tension in my body. They say where we focus our thoughts, we get the results. And I was focusing my thoughts on releasing pain, stress and tension in different parts of my body. And I tell you what, I'm feeling it right now. If you're a little bit curious about trying something different, then reflexology might just be for you.
One of the biggest beauty buzzwords right now is glow. We all want that healthy, radiant skin, but caring for it isn't just about what we use topically. Beauty is also created from within. The Swiss Glow range supports healthy skin from the inside out. First up, there's the Swiss Beauty Collagen Plus Hyaluronic Acid Booster Supplement. With a formula full of skin-loving ingredients, it helps improve skin elasticity and supports collagen production. If you prefer a powder format, the Swiss Beauty Marine Collagen Skin Hydration Powder is a daily beauty nutrition blend. It contains sustainably sourced marine collagen peptides and ingestible hyaluronic acid known as sodium hyaluronate. Sounds like a lot, right? But what these ingredients do is help improve skin hydration, because we all know that hydrated skin equals healthy skin. Other beauty nutrients included are biotin for supporting hair and nail health, as well as vitamin C to help with skin repair. To further support your skin from the outside, we compare the ingestible beauty options with the Swiss Skincare 2% hyaluronic acid vitamin B5 Glow Booster Serum. Intense hydration is locked in for a dewy, radiant complexion. We only get one skin, and we have it for life. So when it comes to skin health, it's time to get glowing, people. See what I did there?
Sarah Davison there with some ways to glow this spring. And I must tell you, Jack, I love a skin pamper. Give me all the serums, the potions, the lotions. Can't get enough of it.
Yes, yes, yes. Well, you and I are relaxing at the day spa. Nothing wrong with that. It turns out the key to great skin could actually be found in the gym.
Well, I love this because I'm mad for the gym. I'm very into the weight-bearing exercises for good bone density. It's really important, right? But now I'm going to get good skin from this. I love it. Are you a gym junkie, Das?
Well, I wouldn't describe myself as that, Joe, and some of my old teammates, there's a mixed bag there. Some have let themselves go a touch, but there's definitely a link between good exercise and better skin health. The latest info suggests that a combination of aerobic exercise and lifting weights is actually the best for better facial tissue and better facial cells. So there you go.
I love that. Here's another question, though, Jack. Have you ever done the face yoga that you see on TikTok? Is there any facts in that, I wonder?
I don't think so. I don't think you can trust anything that's on TikTok. But one person we can trust here at the House of Wellness is Dr. Nick. And today he's going to take a look at the often forgotten appendix.
You probably know that some books contain what's called an appendix at the end, which contains important information that's just not needed in the main text. It's named after the Latin word appendere, which means to hang onto. So the appendix literally hangs onto the end of the book. Now, the other appendix that I'm sure you know is the one in the human body, and its proper name is the vermiform appendix, meaning literally worm-like hanger-on, which sounds a bit creepy, but it actually describes it very well, because the human appendix is a small, wiggly, worm-like tubular structure about the size of your pinky that's stuck deep inside the abdomen on the right side. And the first most of us know about our appendix is when it gets infected and we develop appendicitis. Classical appendicitis starts with a kind of vague central tummy pain, which rapidly gets worse, moves to the right side, and then is associated with nausea, vomiting, and often fever. And if it's left untreated, appendicitis can lead to rupture. So when we diagnose it, we normally recommend surgery right away. The commonest time when people get appendicitis is between the ages of about 10 and 30, but the lifetime risk is actually surprisingly high, with about 1 in 12 of us developing it at some time in our lives. And that's why some people who are going to be a long way from medical help are recommended sometimes to have what's called a prophylactic appendicectomy, or appendectomy, as the Americans call it. Think astronauts who are going to be in space a long time and some polar explorers. In fact, there's a town in Antarctica that's so remote, Via las Estrellas, town of the stars, that before you're allowed to live there, you have to have that little wormy thing removed. Now, it wasn't a big deal for Russian GP Leonid Rogozov. He was the only medic on a 1961 Soviet expedition to Antarctica when he developed, yes, you guessed it, appendicitis. Now, Leonid had had a little bit of surgical training, so he took the only option available. Squirt of local anaesthetic, a mate holding a mirror, and he whipped out his own appendix. Stitches out a week later, back to work soon after, no problem. When I was a medical student, I was taught that the appendix was a redundant organ, so it didn't matter taking it out. And while it's true that people are mostly fine, we now know that the appendix plays an important role in our immune defences, and it also may act as a reservoir of healthy bacteria to help top up our precious gut microbiome. So it turns out that while our human appendix may not be essential, it is important after all. Hang on, just like the appendix to a book.
People use foods for more than just their inner health, Zoe. They also work wonders for our outer health.
That's right, Luke, here. And today we are celebrating all things body by creating recipes that you can actually put on your skin.
I'm going to create a coconut citrus scrub, which works wonderfully as both a cleanser and exfoliator.
And the beauty of my avocado mask is its beauty benefits. But you know what? You can probably find all the ingredients in your kitchen right now.
All right, talk me through it. What have you got?
First off, avocado, which is full of good fats and oils which help to really hydrate your skin. They're also antioxidant rich, which helps to reduce inflammation and redness.
I also see you using honey, Zoe. Now, I know it's got powerful healing and antibacterial properties, but a little bit messy.
That's why the yogurt is there. Its creamy texture helps to make the mask easier to apply. You simply pop it on your skin for 20 minutes. And a great tip is you can put it in the fridge. The cool temperatures will equal glowy and plump skin.
Also the end game with my body scrub. The lemons are a fantastic source of natural vitamin C, an antioxidant and brightening agent. And while the coconut sugar is exfoliating those dead skin cells, the coconut oil will be moisturising.
And you know the best thing about using food as your DIY beauty?
Tell me what?
You can eat it.
Can you? Maybe, okay.
I don't know about that one.
Hines and Zoe there cooking up some great dishes that we can put on us not in us. And you know how we just learned about face yoga?
Yes.
Well, I think for me, the best workout for the face and a look that never dates is just a great smile.
Well, you're right. Smiling is a big thing, and having a great set of teeth helps with that too, Jack. And a lot of dentists are on the campaign at the moment here in Australia, suggesting that we are not doing anywhere near good enough job in looking after our oral hygiene.
Well, do you know, I cannot believe these stats. Apparently 20% of people only brush once a day and 75% never floss. I cannot believe that.
I'm really fastidious about brushing my teeth 3 minutes twice a day. But I think something that people just don't know is great oral health is also an indication of your overall health.
Yeah, and the Australian Dental Association is urging everybody to floss once a day and brush twice a day. All up, it should take about 6 minutes. You're right there.
I'm obsessed with my electric toothbrush,
Yes.
Joe. That's something I can never leave home without. Now, from teeth to hair, a breakthrough in the condition alopecia and a new treatment that is bound to change many lives.
Alopecia areata is a specific form of hair loss. It affects certain genetically predisposed people. It's an autoimmune condition. It means that your body's immune system is attacking your hair follicles. And it causes these characteristic circular bald patches. So far, a number of genes have been identified that make people vulnerable to developing alopecia areata. And so in addition to have the genetic susceptibility, you need an environmental trigger to initiate your first patch. A lot of people talk about stress or diet or lifestyle. There's very little evidence for that. The best guess is that it's probably an intercurrent viral infection. Alopecia areata can actually affect anybody of any age. No one is safe. So we know the most common age groups are between about 19 and 60, and that accounts for about 2/3 of all the people affected. But there's also about 20% of people who get it before the age of 18. And in fact, one of the peaks of onset is around about age 5 or 6, particularly in young boys. Up until now, the main treatment have been steroid tablets. And while the steroid tablets are highly effective, generally what happened is that when you stop the treatment, a lot of people, their hair just all fell out again. And the problem with the steroid treatments was that the doses required meant that the side effects associated with the steroid tablets were often worse than the disease itself, believe it or not. But Professor Andrew Wilkes, working at the Walter Eliza Hall, discovered this whole family of medications called Janus kinase inhibitors or JAK inhibitors. And there's a couple that seem to be highly effective in alopecia areata, and this has been a really major breakthrough. And so I think we're really lucky to have these agents that are highly effective, but they've got a really good safety profile. Now, we've already seen in our clinic probably 20 or 30 patients who have been able to stop the tablets completely and have remained disease-free for a couple of years. So there is the hope that there will be some patients who can take this, fix the problem, stop the medications, get on with their life without relapse. So these medications have been approved for adults aged 18 and over. But this is a disease that affects people of all ages. And this is a medication that works in people of all ages. And so we're now starting to do the trials in children aged 5 to 17 so that they can also gain access to the benefits of these medications. These studies have started and we're now actively recruiting for children affected by alopecia to participate in the studies. And what we've seen with these medications is that the sooner you start the treatment, the better your chances of success. If you've had the disease for more than 7 years, it becomes much harder to treat. And what we've actually even seen is that if you've had it for more than 3 years, the response rate is much lower than the people who've had it for less than 3 years. And the other thing that we've also seen is that if you lose all your hair on the scalp, every hair on your head, then the response rate goes down as well. So you don't want to let people develop their alopecia totalis. You want to intervene early. Then that really optimises your chance of getting a good response to these treatments. It's actually very exciting. When I started doing this over 25 years ago, I was pretty much the lone person in Australia treating hair loss because the other doctors found it incredibly draining because the patients were so emotionally distraught by their alopecia. What we're now starting to see is that these medications are becoming increasingly available. Doctors are starting to understand that there's more and more doctors who are interested in treating these patients because they can actually see the pathway and they can actually see the benefits it brings to the patients and how transformational it is to their lives.
Iron is essential to people. It plays a key role in the transport of oxygen through our blood around the body and is important for muscle strength, energy and mental function. Iron also contributes to our immune system. If you've ever felt extremely tired or fatigued, you might be one of many Aussies suffering from an iron deficiency. Iron deficiency develops when our requirements or losses exceed absorption in situations like pregnancy, blood donation, menstrual blood loss, intense exercise, or through following a vegan or vegetarian diet. Your doctor can diagnose a deficiency in iron through a blood test, but once you're already low in iron, it's difficult to get enough back through diet alone. Ferrograd C is for the treatment or prevention of medically diagnosed iron deficiency. A highlight of the formula is the Gradument technology, which assists in reducing the risk of gastric side effects. It also contains enough vitamin C to aid in iron absorption. Depending on the reason for iron deficiency or your individual response to treatment, a course usually lasts approximately 3 months as it takes time to restore iron levels, even if you're already feeling more energised. Remember, iron tablets should only be taken when recommended by a doctor. So if you're not feeling or looking yourself, make sure to refer to your pharmacist or doctor for personalised medical advice. Help is always out there, and if it means we can enjoy the most out of every day, we should accept it.
Sarah Davidson there with the importance of getting enough iron. And I don't know about you guys, but this is my favourite time of year. Vitamin D, blue skies, and you know that summer is just around the corner.
Oh, bring it on, Jack. And you know, for a lot of people, travel plans for Christmas are already well underway.
And I love going overseas, Joe and Jack, one of my favourite things to do. But I have to admit, those long-haul, big-distance flights, they're getting less and less appealing as time goes on.
Well, on that, Qantas and the University of Sydney have just undertaken world-first research into reducing jet lag.
Well, Joe, they monitored volunteers via wearable devices on a 20-hour test flight. It's all part of the airline's plans to start flying direct from Sydney to London and New York by 2025.
Well, the test showed that you can actually reduce your jet lag in 3 key ways. The first one being adjust your lighting and try to sleep to match the time in your destination.
I'm obsessed with that part of it, Joe. You've got to get to sleep at the right time on the plane. I drive people mad with that one. Same goes for changing your meal times. And, Jack, using things like chili and chocolate, whether you want to stay awake or go to sleep, can be pretty helpful.
I don't mind the chocolate part, but the other key point was movement and exercise on the flight. How do you think you'd go, Joe, 20 hours locked in a plane?
Look, 20 hours non-contactable, I think I would love it.
I'm with you about getting up and going for a walk too. You have to keep moving. Well, that's all we've got time for today on the House of Wellness.
Check out myself and Gerald Quigley on House of Wellness Radio this Sunday.
And don't miss our October Lift Out with the body herself, Elle McPherson, on the cover.
Look forward to that. Thanks as always to our great friends at Chemist Warehouse. We'll see you next time.